This next segment is sponsored by Blessing Health System, and Dr. Robert Johnson from Blessing Health System joins us to talk about lung cancer. Good morning, doctor.
Good morning. How are you?
I'm doing well. Yourself?
Fine, thank you.
Good. A very important topic is November is Lung Cancer Awareness Month. So what risk factors are there for lung cancer? I mean, smoking comes to mind.
Sure, and that's the most common one. If we look at about 80–90% of patients who develop lung cancer have a smoking history or exposure to secondhand smoke, something along those lines. We see some folks with radon exposure, which we sometimes hear about, and asbestos. The most common one is smoking.
How treatable is this disease?
So it's become a lot more treatable in more recent years. Number one, we have better ways to find it at an earlier stage than we ever used to. The other issue is we've got a lot better types of drugs that are now used, what we call targeted therapy. You know, we still have chemotherapy that can be effective, but we have these targeted therapies that are very specific that sometimes can really aid in being able to treat these particular cancers.
And how do you screen for this disease? Is this something the patient feels they cough a lot, or how do they detect this?
Some of the symptoms that we have seen over the time have been when the cancer is a little later. So now we do have some screening options. Eventually, we developed what's called a low-dose CT screening in the country, and that went through some trials and eventually was found to be beneficial. Low dose meaning low dose of any radiation exposure. And so in folks who fit criteria, meaning they're heavy smokers or have had a long smoking history, they may be candidates for that. And Medicare and those types of insurance companies will cover that. And so that can find cancers at a very early stage, and then they become very treatable. So we have much better options about curing those folks and treating those folks.
And I would assume one of those things to do preventatively would be to quit smoking, but that's hard to do.
It is very hard to do. We do have, we screen everybody, that basically patients as they come through the hospital or that to say what can we do to help stop smoking. And so smoking cessation classes and smoking cessation counseling is very, very important. And there's proven methods that work better than others. But yeah, it's a difficult process, but very doable. It can be doable.
And you guys offer like cessation classes there at Blessing?
We do, and we have counselors that can work with those folks to give them ideas and suggestions about how they can help stop smoking.
What would you say to a patient who maybe thinks they might have something wrong? How do they know something's wrong to bring up to their doctor to say, maybe I need to be tested?
If they did have something, they were having some lung symptoms, coughing up blood, something along those lines, those are important things literally just to bring, and they shouldn't wait on those. They should bring those up to their family practice doctor or their doctor that they see routinely for an evaluation, and especially if they have that smoking history, because those two together can really increase their risk substantially.
Absolutely. Well, Dr. Johnson, thanks so much for coming in and spreading awareness for Lung Cancer Awareness Month. Again, this segment was sponsored by Blessing Health.